Mr. O'Rourke, you're recognized for 5 minutes.
Thank you, Mr. Chairman. To follow up on Mr. Hulskamp's statement, Dr. Mitchell, I couldn't help wondering during your testimony and in the answer to many of the questions that were asked of you as you detailed the ostracism that you endured, the being shunted aside when you made problems for management, ending up in a position now where you say you're doing good, but it wasn't the position that you signed up for. And then I know you just clarified it, but earlier saying you would recommend to somebody who's thinking about working for the VA, not now, not until we get accountability and oversight and protection for whistleblowers. I couldn't help wondering why you stayed.
I stayed for a couple of reasons. One, the work is incredibly fulfilling and important. I went back to medical school specifically to be a VA physician because I saw there was a great need. Everyone who works at the VA knows there are limitations. That we're a federal department. There are limitations. The veterans are so grateful for the quality of care. You'll see such a wide variety of people at the VA and certainly disease states. From a physician standpoint, it's interesting. My background is geriatrics. It was a playing field for geriatric. In fact, ER was geriatric urgent medicine at its best. It's very interesting. It's very fulfilling. I don't always feel so resilient, though, as a physician there. I'm definitely tenacious. I'll give myself that. But sometimes it's really hard. There is that knot in the center of your stomach driving in where you just don't want to show up because as much as you love the veterans, the administration wears you down, and you begin to doubt your own professional abilities.
Just from your answer to my question and what you said earlier, and really for everyone on the panel, I mean, we keep asking about culture, which is the most important issue, but probably the most difficult task before us as a country in terms of turning around the VA. But you really represent the culture that I think we're looking for and that we want to see throughout the system, not just at the provider level, at management, at the secretary level, on through this committee, and again, as a country. So I want to thank you for that, and thank you for the example that you provide. But I also want to follow up on another comment that you made. You mentioned surviving 16 years of this, and these problems didn't just occur, under this administration or the administration prior to that, but they're long-standing. And I remember I've been here for a year and a half, and one of the first hearings I attended was a joint hearing with the Senate VA committee where we heard from the veteran service organizations. And I remember a commander coming before us and saying, this is I don't know what the exact number was. This is the 32nd time I've appeared here. I've been coming up for decades, and I've been saying the same things over and over again. So you said that this is a system worth saving, but my question to you is it salvageable?
Oh, yes. You've got thousands and thousands of employees that are dedicated to the veterans and the welfare of the veterans. I am really discouraged when I hear people say that VA is too big to change. You have an entire group of people that are ready for a revolution, and they want this. They want a productive healthcare system delivering good care. The horizontal violence has to stop. That was one of the implications of whistleblower retaliation, is that it affects care because you don't speak up to say what the problems are because you're afraid of the repercussions. The corollary to that is that you begin to, it's a pressure cooker. You begin to pick on each other, gossiping, bullying, exclusive cliques at work. We kind of feed on each other because we don't know what we're under so much pressure, and that needs to stop too.
Yeah, I wanted to, and you all, each of you have given us some ideas and some direction on how we can make those changes, but I do wonder how we're going to be able to do it after so many years and so many fundamental systemic problems. Dr. Matthews brings up the issue of not being able to trust the integrity of the data, which has become obvious to all of us, and I commend your efforts to measure those things that are important to patient care and outcomes in the facility at which you worked. We've been trying to do that in El Paso. We've seen similar attrition rates of over 40% of veterans seeking mental health who can't get an appointment just give up and stop trying. And we can only, right now, because we don't have the full story, wonder at the outcomes. Mr. Flores and I and Mr. Jolly and others on the committee introduced the Ask Veterans Act, which would not rely on the VA to tell us how the VA is doing, but ask veterans to do exactly what you were trying to measure in your facility. So anyhow, let me just conclude by thanking you all for what you're doing, and I hope that the recommendations and direction that you gave us tonight lead to some of the cultural changes that we all know are essential to turning the VA around. So thank you. Mr. Chair, I yield back.
Thank you.